You are set up.
Okay, hi everyone. I don't know how I'm gonna follow Gabby, that you're so entertaining. But anyhow, I'll just shortly introduce myself. So my name's Liberty and I do womb steaming, also known as yoni steaming, also known as vaginal steaming. There's so many ways to call it. But it's also called parasteam hydrotherapy. This is what Kelly Garza from Steamy Chick is kind of branding this new profession, because it's steaming the whole perineum, not just the vagina, not just the womb. So it's the whole kind of pelvic area. And yeah, I have a presentation, but I don't really know how to do this. So maybe I'll just talk and look at my notes. Okay, so basically, steaming is an ancient practice. I just like to call it steaming because it sounds better. But it's an ancient practice that really has no place of origin. It's been found everywhere and nowhere, from like South Korea all the way to South America. And it's just how women have figured out how to take care of themselves from, you know, when they were, you know, they have gynecological issues to, you know, birth. And as you may know, like way back in time, gynecology was really in the hands of the midwives, because, you know, women took care of women. And unfortunately, this practice was really lost in most places of the world because, you know, with the modern day gynecology, the rise of gynecology and taking birth into the hospitals, and well, you probably all know the story, but yeah, so it is still used in different parts of the world, mostly for postpartum healing. For example, I think they use it quite often still in India and in some African countries like Ghana, Nigeria, and then of course some South American countries, if there's still traditional midwifery being practiced. So it's very beneficial, not just from a physical aspect, but also from a ritualistic aspect. And I think both are equally as important. So yeah, so basically over 70 countries, they've found steaming in the history of, you know, the cultures, even in Europe. Like the first book of gynecology is in Italian, and I think the picture on it shows a picture of a woman steaming. And but they called it fumigation, which doesn't sound as nice. So in some countries they use smoke, and in other countries they use steam. But they both kind of do the same, are for the same purpose. And it is exactly what it sounds like. It's basically sitting over a pot of tea, steam. So like, instead of sitting in a sauna or a steam room, you're sitting over this steam, water being steamed. And it feels really nice. Like all my clients who do it for the first time all say that this is, you know, feels so natural. One even said, which I thought was kind of funny, she was like, oh my gosh, this feels more natural than brushing my teeth. And so yeah, it's not supposed to feel, it's not like some people, they say, oh, okay, they picture a huge like blast of steam like shooting up their vagina, but that's not what happens. It's super soft and calm, and it feels like a nice warm bath. So and it's, you know, a lot of times women think, oh, it should be hot, too hot to work, like, or burn to work, because we have this idea that things have to be painful for whatever reason, and they don't. So yeah, that's basically what steaming is, and I can show you a picture of a the steam chairs that I sell, which I don't know if you can see it. It's a glare. Oh, there we go. This is a cedar box made out of cedar wood and smells delicious. It also comes apart like a puzzle, so it can be quite practical if, for example, you as a doula or as a birth worker wanted to use it for your clients and they didn't want to necessarily invest in a chair for themselves. You could just go and when you do the other stuff like the closing of the bones or belly binding or whatever kind of tools you use for postpartum, you can then just take your little steam chair and set up a steam for them. And so there's so many uses for vaginal steaming, but obviously because this is about birth, I'm going to go into the 3 ways you can steam for birth. And that is basically labor prep. And most people think like, oh, that's so contraindicated because you're not supposed to steam when you're pregnant, which that's right. You're not supposed to steam when you're pregnant. It can be dangerous. But once the baby is full term, considered full term, which is 37 weeks plus. So we look at it basically as if you're prone to short menstrual cycles, then of course nothing's guaranteed, but most likely you might go into labor earlier than 40 weeks and vice versa. If you're prone to late menstrual cycles or missing cycles, then you might go later than 40 weeks. Because as we know, 40 weeks is just a number and it's just an average, and not people don't ovulate at the same time. People don't menstruate at the same time. So it's also, people are not also going to give birth at the same time. But we know that it's safe to give birth at 37 weeks or 38 weeks or 37 weeks. The baby's considered full term. So it wouldn't be like a NICU baby or something. So you can start steaming then. So if my clients are prone to early menstrual cycles, then I start them at 38 weeks. If they're prone to late, then I start them at 37 weeks. And they can start steaming because this is just, we just want to be careful that it doesn't cause you to go into labor, which it doesn't. Like in my experience, no one has gone into labor from steaming, but just in case. It's not like a lot of times people will say, oh, can it help me induce my labor or this and that? And no, it doesn't. So what it does do is it helps relax you. Like if you're, a lot of moms feel a little bit anxious and they're not sleeping so well at the end, everything's getting really kind of tight in, the womb area. So steaming can help relax you and also loosen the ligaments that are starting to get super tight so that there's a little bit more space for the baby. And also it helps you sleep better. So has kind of like a calming effect. And then like what we try to focus on are the 3 things for, helping your body prepare for labor is lubrication, relaxation, and circulation. So all of these 3 things need to be in a good state for labor to happen. So you can't be constipated or dehydrated. And you also need good circulation. And like I just said, everything's tight. So the circulation is not that great at the end of pregnancy. And relaxation, this is the most benefit for that. But it can also help with the other 2 things. So the herbs and the steam can really help the circulation in that area because it's so full of blood vessels. And it's not just going into the vagina, it's going into the skin. And as we know, our skin is really permeable. So when it's going directly into that area. And then I use a lot of, so when they start steaming for labor prep, then we use a cooling and moisturizing blend, again, to help cool you down because most women feel very hot as well. during that stage. And so it's a blend, a cooling blend that I have. And then once the mother feels ready to go into labor, again, not that it's going to induce labor, but I switch the herbs into a, it's called your Renew blend, which is circulation. Like it has a lot of blood movers and herbs that will help get the circulation going. So that can be at 39 weeks or 40 weeks or whenever, you feel they feel ready to switch to a more intense herb blend. And it's always just 10-minute mild steams. And sometimes the baby will get really active after the steaming, or sometimes the baby will go to sleep after steaming. It just it's all hit or miss. And so I always check in with my clients also to make sure that they're having good bowel movements. And if not, we work on that with food therapies, like a lot of slippery foods to try and help with that. And yeah, and then I also, of course, recommend acupuncture and massage to do, like this, what is that called? The massage for the cervix. You guys know, I'm sure. And steaming, and that really helps like the cervix get really supple and soft. So a lot of my clients will go in, perineal massage. Thanks. And then, so a lot of my clients, the doctor will say that their cervix is like super soft, like super pliable and ready to open. But, I've noticed, of course, like how Gabby was saying, and everyone says, like, there's no recipe, there's no guarantees. This is just like another tool that you can use. And if they haven't been induced, if there's no drugs like Pitocin used, if everything was really as natural as can be, then usually there's no tearing if they've steamed for labor prep. But once you start messing with nature, like with drugs and stuff, then, there's all kinds of things that happen. So, so we can't guarantee that if you steam, you're not going to tear. There's no guarantees. But the thing that is most of my clients mostly enjoy about steaming is just the time that it takes for them to sit there and connect with their baby, connect with their womb, have a dialogue, and really take those last 4 weeks to prepare themselves for mentally and physically and spiritually for the birth. And a lot of them are also hypnobirthing, have practiced hypnobirthing for the birth. And so I also get this a lot, that they say, oh, before it was really hard for me to do the meditations and do the hypnobirthing tracks because I just felt so disconnected. But once they would sit on this steam chair and steam and listen to the tracks, it was really like another level for them because they could physically kind of connect. So it's a great combination. And so the other way that steaming is used for birth is during active labor. Now, here in the UAE, it's not really, it's not going to really happen in the hospitals. But if your client or you are home, then you can choose to steam to kind of get some relief, just like you would get in the shower or take a bath or, sit on the toilet or, all these little tools that we have. This is one more that can help. And it especially can help if labor stalls, to help get labor going again. And in the Czech Republic, they're using steaming during active labor with doctors and midwives in the hospital, in 7 different hospitals. And I have it on my Instagram, and it was in my presentation, but you can't see. So this is, this woman who's being steamed during her labor. And the middle one is the lady who she's she studied the same course that I did, and she's the one who is training all of these midwives and to use steam. And everything, of course, is a little bit more natural there than here. So they really will try to use this first before any of the drugs. Of course, if the mother, if that's the way she wants to go. So yeah, I mean, it would be amazing if that could happen here or in other parts of the world. It's the only place in the world that they're doing that. And I think it's quite incredible. So yeah, then after that, we moved to postpartum healing, which is the way that steaming, like I said, is mostly used and most commonly used around the world. I had a client who was from India, and she was steaming with me for a cyst. But it was interesting because when I met her mother, she was like, "Oh yeah, I steamed after I delivered you," and she had totally forgotten that that's what she had done. But anyway, so you can basically start steaming for postpartum once the uterine vessels, you can confirm that the uterine vessels have closed. And it can be 24 hours for some women, and it can be 4 days or more for other women. It just depends. But the way we kind of calculate that is the amount of pads that you go through. So if you're using an overnight pad and you're changing it every hour, then it's still way too soon to steam. But once it starts slowing down to where you're changing it like every 3 hours, then if you're comfortable, then you can start steaming. Some people still like to wait a little bit more because it's kind of foreign to them, but it is most beneficial if you start doing it as soon as you can, because it's going to help with the afterbirth contractions. It's going to help with any healing, any stitches or tears that you might have, and also just reduce the swelling of the labia, and also will help close the cervix and the vaginal canal sooner. So, which is what we want. So all the organs and can go back into place, and the pelvic floor can start supporting you. So this is a story about my sister, actually, who she had her first birth, and her babies are big. She had her first baby was 10 pounds, and she had the vaginal birth, but with a vacuum, and it was a very traumatic experience for her. But anyways, that being said, with her second baby, she steamed for labor prep, and also she steamed postpartum, even though the baby was very, very big as well. There were no tears, and but there was damage done to the pelvic floor, and her doctor was like, well, you're going to definitely need to do physical therapy. You're probably going to have some bladder prolapse, but let's just see after 6 weeks, and then we can go from there. And she steamed, also not every day like I recommend, but she steamed maybe 3 or 4 times a week. And when she went for her checkup, her bladder had totally gone back. She didn't need any physical therapy, and she didn't need she didn't have any incontinence or anything like that, or bladder prolapse. So that was pretty incredible. And steaming can even help people who still suffer from prolapse later on, but it's really most effective if you start steaming right away. Or as soon as the uterine arteries close. So yeah, it helps clear out the lochia and the blood, so you aren't bleeding as long. And this is good because it prevents infections, and it's just much more comfortable to be done with bleeding as soon as you can. Also for the contractions. And the other thing that steaming helps with is hemorrhoids. So even in the last few weeks of of pregnancy. A lot of women suffer from hemorrhoids, so it's helpful when they do the labor prep steaming for that as well, but also postpartum, the hemorrhoids that happen postpartum. And then the other thing that is beneficial is that it stimulating the cervix releases oxytocin. So this is good also for labor prep, but also for postpartum. And so it can help with like the milk production and just the overall mental health of the new mother. The other thing that most of my clients also find is that it's just, they feel less anxious and less tired, just to have this ritual that they can go to every day for them, you know? It's not about the baby. It's not about, you know, anything else. It's just me time, and just sit and, you know, meditate or process being a new mother, process the birth. You know, sometimes I recommend journaling or other things to just really kind of come in tune with how they're feeling, and allow all these feelings to happen. And there's also, I find when women give themselves the time to do this, that there's less of this postpartum depression. Of course, nothing's guaranteed, but it's another tool in the toolbox. And I also most times recommend the husbands learn about this, how to prepare the steam, especially for postpartum, because it might be the last thing on your mind that you want to do because you're so tired and all these other things that are going on. But if you just have someone to just make it for you, and just, you don't have to go anywhere, just have it next to your bed, the chair, everything ready. They make it for you, and you just sit there and enjoy. So what else did I want to say? I guess, oh yeah, so when you steam, so I usually sell a whole package, and that includes the consultation for, yeah, that's what I'm doing. The consultation for labor prep, the consultation for postpartum, and the steam chair. And then you get 3 jars of herbs. So the cooling blend, the cleansing blend. The cleansing blend you use for the last few weeks of labor or of pregnancy, and then you also use that right after giving birth until you finish it, and then you switch to the You Empower blend, which is a gentle blend and will help keep your period away while you're breastfeeding. So you finish your 30 days of steaming, and then you steam once a month until your period returns or you stop breastfeeding. And yeah, so the whole package is 999 dirhams, which is basically a savings of 461 dirhams if you were to buy the chair on its own, the herbs on its own, and the consultations on their own. So it's a pretty good deal. And again, the chair is cedar, 100% cedar, and smells delicious, like you're in a sauna. Let me see if I have any questions. What herbs do I use? Yeah, so I have 4 different herb blends total, but 3 different ones that we use for steaming for the birth, which is a cooling and moisturizing blend. So basically all the blends have the same base, which they have like blood tonic, liver tonic, some disinfecting herbs, and all this. But on top of that, there's more cooling and moisturizing herbs like calendula and comfrey. What else off the top of my head? Mint or lemon verbena. And then the cleansing, again, has the same base. And then it has rose, which is a circulatory herb, motherwort, and dandelion, these kind of things. And then the gentle blend, which is again to strengthen the uterus but also keep the period away, is what is it? Yeah, again, same base, but it has yarrow, holy basil, and astragalus, which is, these are all like strengthening, and yeah, smell delicious. Oh yeah, and the other thing that I wanted to say too was that it's a good thing to try and steam before you go for your group B strep test, because it can sometimes, it's not guaranteed, of course, as usual, but it's a good option, instead of putting garlic or whatever everyone else does, like this, the steam and the herbs can help ensure a negative result. So does anybody have any other questions for me? No? I guess I'm done super early.
No, it's not super early. Thank you so much. You did amazing. Tell us a little bit about the retreats you're currently hosting in Dubai. I see them pop up on my feed all the time, and they just seem amazing.
Yeah, so I'm doing a weekly womb steaming, cacao, and sound healing journey with a friend of mine. Her name's Lisa. We have 5 women at a time in the space, and it's just really powerful because I believe that energetically, as women, we hold a lot of trauma in our womb. We hold a lot of not just from our own lives, but from our ancestors, from the collective as well. And when we come together in a circle and go through this, so we have the cacao for opening the heart, and then the steaming to connect to the steam, and the sound healing, which is crystal sound bowls, and it's just amazing. So we do that weekly in Dubai, in the Marina area, and it's 300 dirhams per session. So it's you're getting 3 things, so it's a really good value, and it's a great opportunity to try steaming if you're not ready to like buy the chair and do it at home as a regular practice. And then I'm also doing a day retreat on a farm outside of Dubai. It's about 45 minutes. So this is a whole day of, which is coming up this coming Saturday, if anyone wants to join. 600 dirhams, and we're starting at 9 a.m. going till 4 p.m. And it's got basically a meditation with horses, and it's going to be only women, like mares, so female horses, because we're all about women. And then we are going to have some womb yoga and some lunch made from the organic vegetables from the farm. We do some painting and steaming, of course, and then also Tibetan singing bowls for sound healing.
Yeah, I need you to stop saying stuff because Mel's about to start crying. She's all the way in Australia. Can't join.
Why did I know?
She's crying over there. I can see the suffering in her face as you keep mentioning things. But there's 2 questions. So we have 3 minutes, but there's 2 questions. Maybe you can go over it quickly. They want to know if somebody can use it as soon as she's done with her 40 days. Can she bring her baby with her to the farm trip? And the other person wants to know, can you use steaming for fertility issues? These are the 3 questions that have come in. So 1, can you use it after 40 days? So, her first 40 days postpartum. I think you answered that yes, immediately after the 40 days, they can use.
Okay, so
you can answer that one first.
Perfect. Okay, so for IVF without even looking at their period or their menstrual cycle to see how can we fix that first. And then, of course, if that doesn't work, then go to the extreme. But some people have, yeah, anyways. So definitely try to get your cycle in track, and then that will help. So can you bring your baby to the farm? I believe so. I mean, as long as, you know, you're with your baby, full responsibility. But I can definitely check with Gertrude, who I'm doing this with, just to make sure that that's okay. But it's going to be all women, and there's only 8 women joining this retreat. So if you want to send me a private message, then I'm happy to be in touch.
So we're going to continue to Jasmine, because I see she's here. So like all these other questions, we're going to have Liberty if you can make a post on your Instagram about, you know, answering these questions maybe. And everybody, please check out her Instagram and follow her for sure, and check out all her great events that are coming together.
Yeah,
so,
my Instagram is Liberty Steams. So.
Yeah. So again, birthsymposium.com. If you can't, you know, don't know the spelling, just check her out. Her picture's there with her little link to her Instagram underneath. Okay.
Thank you.
Thank you so much for coming. We're going to have Jasmine take over. I'm going to spotlight her now. Just give me 1 second.